Thanks very much, Sam, and thanks for inviting us along to speak today. My name's Sophie Gwither. I know some people on the call. I'm a lead officer in our Protecting People team in Dundee, and my remit is mainly around working with the Violence Against Women Partnership and the Child Protection Committee, and I currently chair our trauma steering group. And I'll let Mel introduce herself.
Hi, I'm Melanie Hyatt and I'm on the Protecting People team in Dundee as well, and I'm a development officer and I work across our partnerships. I generally work on our prevention portfolios, the gendered services, and I also support the children and families work around families experiencing substance use issues. So a mixed bag of things, and in terms of some of the stuff we're going to talk about today, I've kind of come in for some of the topics working with Sophie recently. So Sophie, if you want to start, I suppose.
Yeah, great. Thanks, Mel. Okay, so we were asked to talk a bit about our approach to lived experience in our Protecting People world in Dundee. So we're gonna do a little bit of background context because I think that helps in terms of how we've been able to do some of the work that we're going to talk about, the specific examples. So we're going to talk about our Transforming Public Protection programme just briefly, and a bit of work that we're doing under that in relation to lived experience. Then we're going to spend a wee bit more time looking at a specific example in Dundee where lived experience has been really powerful, and that's our Gendered Services project. And finally, we'll talk a little bit about a piece of work that's sitting in our trauma implementation plan, which is around professionals with lived experience. So that's just a little bit of structure for you. Can I have the next slide, please, Anna? So yeah, in terms of the context, I always start off with this, all the presentations that I do around VAW and things like that, because I think it's really important. So the context, for the work that we're doing really starts with the fact that we've got this integrated Protecting People structure in Dundee, and I know that other areas have the same, but I find that it really kind of provides the foundation for us to be able to take a whole systems approach to some of the work that we're doing in Dundee. And it applies obviously in the context of lived experience as well. So when I say integrated Protecting People structure, what I mean is, excuse me, all the public protection committees and partnerships that we have in Dundee sit in one structure and report directly to our chief officers groups and have kind of direct links with each other. And you can see on the screen there the different groups that I'm talking about. And then the strategic support team that Mel and I are part of kind of sits together as a whole unit as well. So all the kind of strategic support for the ADP, Child Protection Committee, Violence Against Women Partnership, we all sit as one team, and that has really good kind of benefits in terms of cross communication and sort of sharing approaches and developments and ideas. So it is the foundation for everything that we do. One of the things that's been really helpful during COVID has been that we've developed this integrated public protection risk register, which kind of enabled each of the committees to have a look at their own specific risks, but it also helped us really see where the cross-cutting issues were. So again, that's kind of really accelerated what we've been doing as a whole system approach. Another example is we've got the Transforming Public Protection programme, which I'm going to speak a little bit more about in a minute. And that's been going in Dundee for at least 2 years now. And the programme really does what it says on the tin. It's looking at transforming public protection. And really, I suppose at the heart of it is trying to move us away from the siloed approach to public protection issues and look at a more integrated way of working. So that structure and the Transforming Public Protection programme are the kind of backdrop and foundation to the lived experience examples that we're going to give. But I'm just going to go into a little bit more detail about Transforming Public Protection with the next slide, and then pass on to Mel for a specific example. So you can see up there, we've got two kind of strands of Transforming Public Protection. So we've got TPP1, which was a 2-year programme, which we've just come to the end of, and it really focused on, it came out of some inspections in child protection and adult protection, which kind of were pulling out very similar themes around chronologies, risk assessments, information sharing, all the usual kinds of things that come out. So Transforming Public Protection was designed to really look at safe systems of practice that are resilient and promote consistency and quality across all protection responses. So it was looking at driving culture change within operational services. It looked at leadership, kind of enhancing leadership for public protection, and looking at streamlined coordinated processes that responded to the complexities and interlinked needs of the vulnerable individuals and families in Dundee. So looking then at Transforming Public Protection 2, TPP2, so we've just come out of TPP1 and that was going on during COVID, and just kind of reviewed and refreshed what we want to do with TPP and have come up with our sort of second iteration of that. So the sort of things that strike me most about the two versions of TPP are, you can see the increased importance and emphasis in Transforming Public Protection 2 on the multi-agency and collaborative approach. So I suppose all the committees still have some aspects of work which sit exclusively within them. However, there's so much kind of cross-cutting stuff, and you'll all be aware of that. It's really difficult to separate out, this is specifically the ADP's bit of work, this is specifically violence against women. Some of them cross over so much. And Transforming Public Protection has really recognised that. So this ethos is reflected in everything that we're doing in Protecting People work at the moment. And I'm going to kind of hand over to Mel just now, who's going to talk through one strand of work sitting under Transforming Public Protection, which relates to the lived experience approach. And the reason that it sits under Public Protection TPP is because it cuts across all the different committees. All of the committees are, you know, thinking about and grappling with how do we involve people with lived experience in our work. So I'll pass over to Mel. That was just a bit of background there, to talk about the lived experience review.
Sorry, I'll turn on my mic now. So basically, one sec. Yeah. So under this, so I guess just to follow on from what Sophie's saying is a whole systems look at our lived experience engagement across our partnerships and their inclusion in the strategic decision-making processes, the linked strategic planning and the improvement in the development program and activities. So I think the key here is that there's three pieces usually in terms of when we think of engagement with people in terms of our service design and delivery. You have mutual aid, so people in services working along, supporting others. You have your quality assurance piece. And then you also have this wider topic that we're kind of talking about now around engaging people with lived experience in your actual strategic forums. And how do you do that? And I think if we go back a few years with one of the partnerships I was working with, this is kind of born out of that a little bit as well, in terms of there was a lot of really great work going on, but there seemed to be this disconnect in bridging that into the actual strategic forum. So there was a lot of people in the communities, a lot of people in services, they had all this great input, but there wasn't necessarily the space in the way that our systems are structured to hear those voices, and that was really difficult. And so I think when we look at TPP and how we're going to do that, that was one of the things that we wanted to do. So I guess in terms of the review process, which covering all of us, we also know there's been a lot of different types of engagement across all our partnerships. There's been a lot of genuine effort across our partnerships, and there's also been pressure and focus on the value of lived experience nationally. So this is like really, really important, but we've also recognized that it needs the time and the resources to make it meaningful, which can be quite difficult given the way the systems are structured. So there's a risk that the pressure in strategic forums to include lived experience, and this is kind of what I think Shamala was touching on before, can lend itself to that tokenism, only a single person having a voice or a say. You know, people can feel let down or used, or we can even re-traumatize people when we do this. So there is a really important point of being that we actually need to make sure this is done in a meaningful and a trauma-informed way. So through some of this review work that we want to do, we want to look at what our barriers and our challenges are, and then we also want to develop a shared understanding of what meaningful involvement actually means and what it means to actually be trauma-informed and safe. So that's kind of the crux of the project. So if we can go to the next slide. So there's two key points and two key deliverables for this. And the first one is developing a better understanding of the current approaches of lived experience strand across our public protection partners. So, you know, things like identifying our strengths and weaknesses, our gaps in our engagement, and recognizing current engagement and best practice. And then the second part of that first point is actually reviewing our leadership planning and decision-making processes and the impacts on outcomes in regards to engagement of people with lived experience. So we actually want to have a look at what is some good decisions that we've made that engaged with people, and what were those outcomes, and maybe what were some decisions that were made that could have engaged with people better and would have potentially led to a better outcome. And I think we want to use those to then facilitate a reflective discussion with our leadership on findings, co-production, and next steps. So to really kind of use local examples to create the space, and how can we actually create the space on a leadership level to engage people with lived experience. So I don't know if there's anything you want to add on that, Sophie, but I think that's the crux of the project, cross-cutting, because we know that a lot of people in a lot of the different engagement groups that we have cross-cutting issues. You don't just experience one form of trauma in isolation. So we don't necessarily feel that engaging in isolation as well has really been helpful or supportive. Sophie, anything to add on that or no?
No, I don't so.
Yeah, so it's quite an exciting project, and I think we're really hoping that through this process we'll really start to be able to embed people's voices in a much more meaningful way. And I think kind of through this as well, we kind of go on to the next slide and look at a few current examples in Dundee that we feel that are, kind of making waves and starting to work very well and quite exciting projects. So it's separate than the review, but, I think we would envision that these probably would be highlighted as good practice through that review. We obviously don't want to get ahead of ourselves in that, but obviously we feel that they probably most likely would. So we thought we'd share those with you today. And the first one is the Gendered Services Project. And the key aim of the Gendered Services Project is embedding gendered approaches in service delivery in Dundee. And this kind of goes back, started quite a number of years ago. I wasn't really involved, I was kind of on the sidelines, but more recently I've been supporting the gendered services work and we now have a manager in place for the Gendered Services Project, and it's aiming to improve service responses to women who experience gender-based violence, homelessness, substance use, and other multiple complex needs that require support from a wide range of services. And so we aim for the services to become more gendered in their design, their delivery, and their ethos. I know in Dundee, there was an identified lack of understanding around gendered and the specific needs that women may have that can prevent them from accessing it. Appropriate care and support, and where they do engage with services, engagement being successful. Consequently, due to this identified need, Dundee Women's Aid had applied for CORA funding for research, and this encaptures what training and support agencies require and what changes they have to make sure that services are meeting the needs and accessible to women. So I think this report and the crux of this report is that this whole project has actually been driven from the outside by women's voices. And I think that's the key point, is that the research was looking at barriers women experienced. I think they interviewed around 39 to 40 women through the research, and it highlighted the different barriers they face, made recommendations for how you move forward. And through that project and those recommendations, then funding was applied for, the project coordinator was put in place for gendered services. And this was also supported by the fact that in 2019, the Drugs Commission came out, and they also highlighted that there was a need for services to become more gendered. And that Drug Commission also, a lot of their deep dives and a lot of the stuff that they did came from actually meeting with people in the community and hearing what they had to say. And then there's also now, in terms of this project, the project itself on an ongoing basis, regularly, Heather is our project coordinator, she regularly meets with women in the community, and through that work, their voices and what they're saying is actively, regularly inputted into the strategic forum, and also has influenced the development of the training on quite a wide scale. So I just thought maybe we could give you a few examples of some of the things that the women are currently involved in. So I'll just bring that up, sorry. So I think initially when the project coordinator came in place, they reviewed barriers and access to barriers with women, and they facilitated discussions with women about what they'd faced. They also visualized components of a perfect service. That's all kind of been developed into the training as well. The women that Heather worked with and meet with, they've developed self-assessment forms. So that's research and output, and those self-assessment forms are now, so agencies are supported to use those forms to have like gendered walkthroughs of their services. Is this a gendered service? How does that work? They also had input in developing a key component of the training around an empathy map. So our project coordinator met with the women, and they made actually significant changes to the empathy map for the training. Questions that we would ask people: what is she not saying? What is she saying? What are we not hearing? What are we hearing from women, and what does that mean, and how does that show up in services when we're supporting women? And one of the things that we're going to show you today as well is an animation. The women actually developed the storyboard and used examples from their life, and this animation is part of our training as well. And it's actually kind of making waves, I think, within the strategic forum, because we show it where we go. We'll show it to you today. We think it's absolutely fantastic, and it kind of hits home, I think, in terms of what a gendered approach is and actually how simple it could be. And it'll mirror trauma-informed practice as well. So I think that's quite amazing. We've also had women in the project have input into our health improvement service Pathfinder experience through the Alcohol and Drug Partnership. So this is kind of where we start to cross-cut in terms of some of the work with our VOL partnerships and our alcohol and drug partnerships and mental health. So they use their experiences to create maps of how many access points there was to their service, and it actually showed just how complex the journey is when you're trying to seek care, right? So all the different points of service context, all the different wait times, and actually just looking at that map that those women developed made me feel overwhelmed. I was thinking, this is actually an incredible journey that you go on to try to get the support that you need. So, and now that group, based on those maps, there's going to be a co-design group around the mental health service user pathways and actually bringing together mental health and substance use support so that you can kind of get support at the same time for co-occurring issues. And they've also made a series of videos that are going to be used for training as well around the key elements of what a gendered approach means. And those videos as well, I think some of them were actually shown at the VOS Summit, which was held in Dundee a while back. And the VOS Summit was a leadership piece of work in terms of that. I think Sophie could probably speak about the VOS Summit a bit more because you were actually there. And then up and coming as well, we're hosting a neurodiversity conference, and the women have done a walkthrough and made recommendations to make sure that the conference is actually accessible for people in the community. So I think, you know, those are some of the key bits of work, and that's kind of ongoing. And I think what works really well with Heather's approach is she goes and she meets people in the community where they're at, where they're accessing their service, where they're comfortable. You know, we're reaching out, going to them, and then also feeding back regularly what their impact, the impact that they're having, how that's working, and it's the nature, and there's a budget attached to it. Do you know, there's key pieces of this program that it's actually, when you break it down, it's quite simple. You know, it's listening to what they're saying, making our services and changes designs based on that, but also, you know, just doing what they're, you know, just actually listening to what they're saying and meeting people where they're at and including them in a meaningful way. So I think being able to highlight back to them the impact that they're having within our service development is one of those key pieces of that work. And also, some of the women have also suggested that what they thought was going to be really important when they go to a service is understanding that that service is gendered, that it would make them feel more comfortable if there was some sort of guarantee or charter mark to say, we know what it is, we understand domestic abuse, we understand what a gendered approach is, and if you come to our service, you can expect that service delivery to be that. And that actually came directly from the women. So now we're in the process of doing that, developing that charter mark for agencies, and part of that is through our gendered services training that we deliver. And then after the training, we try to follow up in terms of helping agencies with their self-assessments, helping them implement gendered approaches, and then kind of once they've gone through that process, they can get that mark in that charter mark. And it's underdeveloped at the moment, and it's very much under development, you know, with the women that Heather is working with on an ongoing basis. So I think those are some of the ways in which they're being included in that work. There's also proposed work coming through around developing a safe space cartoon and kind of showing what safe spaces look like. You know, developing a champion group. I know that there's going to be a women's hub in Dundee coming up, and I know Heather, the project coordinator, is kind of looking at developing a bit of a panel in terms of the development of that hub and actually making sure that the women and the people that we're working with in the community are having a fairly big influence on the design of how that hub is going to function. So that's still, I think, an incredible project to come in terms of that. So that was kind of a long-winded explanation. Sophie, is there anything you wanted to add, do you think, around that project?
I suppose in terms of the hub, the whole evidence base, well, not the whole evidence base, but a big chunk of the evidence base in the funding application that we put in for that came from Heather's group of women with lived experience and what they were telling us. So that's been instrumental. They've been instrumental in that as well. And I guess we're just starting to observe things now where agencies are starting to understand what we mean by a gendered approach, and they're starting to come to us rather than us having to go to them. So there was a recent round of funding for Cora sort of within the substance use world, and Heather was seeing services coming to her to say, can you help us make sure that our application is gendered? And for me, that was like the biggest win ever, that people are actually recognising the need to do that and trying to do it properly. So yeah, it's a fantastic bit of work, and what the women have done is amazing, and we do link in with them regularly. I speak to them regularly as well and kind of feedback if I've been at a forum like this, and you know, tell people how much of an impact what they've been doing has made. So we try and keep that going constantly. I think, sorry, Mel, go to
I was going to say, just in terms of, you know, some of the cross-cutting stuff as well, and getting those women's voices not just into the VAW partnerships, but the other partnerships across our sector. So now Heather, project coordinator, is going to be, she's going to be a key member of the strategic group looking at you know, the development of the residential rehab pathways within our alcohol and drug partnership. And with her being there, you know, that's a real opportunity for those voices to be part of that now as well, not just you know, a siloed look at people who are experiencing alcohol and drug issues and that's only where they're presenting. Do you know? So it in terms of the way that that project is having waves, it's actually having waves across the partnership, not just within the VAW sector, which I think is a key point.
I think, are we going to watch the animation now, Mel?
Yeah, so next we'll show you the animation that the women developed. So we obviously had a bit of you know, our tech design people put it all together, but the women designed the storyboards. They and these are real. They, you know, there's been a bit of creative license, I guess, in terms of it, but the examples that you're going to see are real life examples of the women in the storyboard that they've created, and yeah, we think it's pretty great. So
I think they provided some of the voiceovers as well.
Yeah, they also, yeah, thanks, Evan. Yeah.
Little work.
Cases of domestic abuse are on the rise in Dundee, and levels of support for women and families who've experienced this still remains unchanged.
I would like a house for myself and 2 children. I don't mind the location as long as it's near good schools.
Why do you want to move? You're already in a nice area.
I've split up from my partner because he was violent. I can't stay in the house anymore.
Okay, we'll see what we can do. It can't have been that bad. You've had a couple of kids together.
What skills or qualifications do you have?
Nothing. It's been a long time since I've worked.
Well, I bet you regret not keeping up with the qualifications now. We are very concerned about Holly's behaviour. She is not completing her homework, doesn't pay attention in class, and her marks are much worse than last term.
I'm so sorry. I'll try to check in with her more about her homework.
Your husband has already been in touch to say that you're not coping since you decided to live alone. Perhaps we should involve some guidance staff?
I'm not sleeping. Can you give me something to help?
Why do you think you're not sleeping?
I've currently got some issues at home.
Here's a pamphlet on healthy living. If that doesn't work, we can talk about sleeping pills, but I would only give you a week's worth.
I hear from the contact centre that your client has been obstructing her husband's wishes to see his children on Saturday mornings. The non-compliance concerns me. If things don't improve, we will have to review the contact arrangements.
Dundee has embraced a gendered approach to their service delivery. One example is the new advocacy service for women going through the court process who have experienced domestic abuse.
I've booked us a private room, but if you prefer, we could stay in this open plan area.
A private room is great, thanks. I've split up from my partner because he was violent, so I need some place to live with my children.
If you want to stay in the same area or the same house, we can help you do that safely. There are many options available. Once we have spoken about your requirements, I can also pass your notes on to the job centre. Would you prefer to speak to a female member of staff?
Yes, I would appreciate that. Thank you so much.
Hi Carol, Joan from Housing has told me to expect you. I'm aware you're here to apply for universal credit, but just so you know, there's no need to look for work for the next 26 weeks. If we know more about your income and outgoings, I can support you better.
I didn't realise that was the case, thank you.
I'm aware you have 2 children to look after, so if it's easier to discuss over the phone, just let me know. I will try my best to work around your needs.
Thank you, I appreciate your help and understanding.
Hi Carol, thank you for taking the time to see me today. We've noticed that there's been some changes to Holly's behaviour and her work.
There have been some changes at home recently, and I was hoping this wouldn't impact Holly at school.
We're here to support you all. There's some options that we can discuss. And also, if Holly is feeling overwhelmed during the day, I'm available to talk.
Thank you, they all sound like really helpful options, and I'll let Holly know.
I'm sorry to hear you're not sleeping well. Why do you think that might be?
I'm just worried about so many things. Money, where to live.
We can look at your sleep and perhaps prescribe some medication for the short term. Another way that we might help with your worries is if we arrange some counselling. Would you like a referral?
That might be good.
Shall we arrange another appointment with you next week and make any further changes if need be?
Yes, I would appreciate that.
I realise court is an intimidating setting. If you don't feel able to speak, your solicitor can speak on your behalf. Now, there seems to be some disagreement about contact. Are Saturday mornings the best time?
My client informed me that the children attend a drama group at that time.
Would your client be free on Saturday afternoons at 2 p.m?
Yes, that's suitable.
Would this allow Holly and Jack to attend the group?
Yes, thank you.
How do you feel after that?
Much better. I was anxious, but I was glad you were there to support me.
Thanks, Amy. Thanks for the clapping hands. Yeah, we're really proud of that little animation and just what the women kind of did with that. So for me anyway, I mean, I've watched it lots of times, but it's so simple, but it shows, I think, just how small changes could make a big difference in just the way that you approach things. So it does seem to be making an impact when we show it, like Mel said. I'm aware of time. I think we're running over time, aren't we, Sam? I'm so sorry. So I'll just whiz through.
No worries, Sophie.
I'll whiz through the last little bit. So yeah, Mel's given you an overview there of the Gender Services Project as one example of what we're doing in terms of lived experience in Dundee. And the other one that I wanted to pick up quickly is a bit of work that's coming through our trauma implementation plan, and that's the idea of professionals with lived experience of trauma. That's been something we've been thinking about for, thanks for everybody in the chat, I can see all the messages pinging up. We've been talking about for quite a while. I suppose to try and sum it up, we're talking about lived experience obviously here, and we talk about it a lot. So how do we do that? And sometimes it's really challenging, particularly with the sort of strategic forums, to think about how do we get the voices of lived experience into those forums. And it always struck me that particularly with trauma, when you think about the stats, I can't think of them off the top of my head, but they're so high that, if we think about our workforce and the professionals who work within that, there's got to be a really, really high number of people working in the workforce who have lived experience of trauma of some form. And why are we not thinking about including their voices in what we do? So I suppose the whole point of the professionals with lived experience work was to stop thinking about the us versus them, which you've got up on the screen there, as in the people who are currently using our services, the people who are currently going through issues, are the people whose voices we want to hear, and not thinking about the fact that we've got all this potential resource and experience within our workforce. And the challenge around that is probably the culture that most of us work in, some may not, where you have a professional persona and you tend not to discuss your lived experience in your professional role. In fact, in some places it's actively discouraged, and the sort of the old idea that you leave your problems at the door and you don't bring those in to work with you. So I suppose the whole professional with lived experience bit of work has been to try and break down some of that. So obviously it seemed like it was quite a radical idea at the start and people were quite anxious about it. We got a bit of pushback, but we've chipped away and chipped away and chipped away, and I think we're starting to get it moving now. So we did a launch of our trauma-informed implementation about a month ago, and at that we started to introduce this idea of professionals with lived experience. So to kind of get to that point, we did a lot of work with leadership and management in terms of persuading people that this was something that was a good idea. We did a lot of exploring how we do this safely for employees. How do we make sure we've got that management support? We spoke to the people who are involved in our trauma steering group from a psychology point of view about, how do we make sure this is emotionally safe for people to do? We've had discussions with HR, we've had discussions with trade unions. So we've gone through a whole load of work to try and get this idea to start moving. We've also developed a process. So at the launch and subsequent kind of management briefings that we're doing at the moment, we introduced the idea that we are inviting people who see themselves as professionals with lived experience of trauma to come and be part of a working group. And there's a whole process around that to make sure that it's safe. So people express an initial interest, and then there's a much more detailed information document given to them about what is entailed. Then there's a screening discussion to kind of identify, what's people's motivation for getting involved. Are they at a point where this is something that is going to be safe and meaningful for them? And then obviously there's consent and things need to be given. So that's sort of where we're at with it. We're just at the starting point, but we've been rolling out these briefings now for the last few weeks, and we've got about 9 people have expressed an interest in being part of the professionals with lived experience group, which is fantastic. And it makes me so kind of happy when you just open that door just a little bit for people to say, this is something that we recognise exists, that there are people in the workforce who are professionals, but they're also humans and they have experiences. Would you like to come and talk to us? And you can just see people, jumping on the opportunity. So it's fantastic, and we're really excited about where it's going to go. This is my favourite little slide, which kind of sums up the whole what we're trying to do with the professionals with lived experience bit of work. So I'll just leave that there for people. I used to use this quote when I worked at Women's Aid, and I still stand by it now, and it's kind of at the heart of what we're trying to do. So thanks very much for having us to speak.